My name is Efiani James, and today I'll be discussing the topic of Legionella pneumonia in immunocompromised patients. Today, we present an interesting case where immunocompromised patient who rapidly decompensated from a Legionella infection. Legionella disease occurs when pneumonia develops secondary to Legionella. The likelihood of severe infection and possibility of death is observed in patients who are elderly, male, immunocompromised, have renal disease, hospital-acquired infection, and malignancy. Case report. A 71-year-old female with past medical history of HIV on antiretroviral therapy presented to the emergency department with 4-day history of fatigue, cough, shortness of breath, nausea, and non-bloody diarrhea. Vital signs and physical exam revealed mild tachycardia and hypoxemia. Initial evaluation of CBC revealed white blood cell of 14.8 and CMP revealed sodium of 131, potassium 5.2, and creatinine of 5.9. Procalcitonin was also done, which came back 16, BMP greater than 70,000. Venous blood gas was done with the following: pH 7.22, PCO2 of 33, glucose was 346 with an anion gap of 29, and beta hydroxylase of 1.36. Patient's course. Patient was started on BiPAP, had a central line placed, and given a fluid bolus due to presentation of septic shock. Amiodarone bolus and drip was also given. Insulin was initiated. Antibiotics, cefepime, and vancomycin were started empirically, as well as azithromycin to cover a typical pathogen. A CT of the chest revealed a right-sided pneumonia with parapneumonic effusion. During our hospital course, the Legionella urinary antigen was positive. Blood cultures were positive for coagulus negative Staphylococcus, possibly a likely contaminant. Patient continued to decompensate with worsening respiratory status, was intubated, and ultimately required 3 pressors. Eventually, patient was extubated, placed on BiPAP, and nitrogen drip. However, patient developed acute respiratory failure with hypoxia, was intubated, but family requested hospice care. Discussion. Legionella bacteria resides in fresh water and can be found in hot tubs, conditioning cooling unit, and fountain. It causes disease after inhalation with presentation of cough, shortness of breath, chest pain, diarrhea, nausea, vomiting, and confusion. Legionella infection can occur in isolation, but also can present with co-infection in immunocompromised patients. In conclusion, this case illustrates the impact of Legionella infection in immunocompromised patients and how these patients may rapidly decompensate. It also shows the importance of covering for atypical organisms caused in patients with pneumonia. That is the end of my presentation. Thank you for listening.